Thalia Marrington, and I'm the portfolio holder for community safety and wellbeing. So my new role, my top priority really, I think is, I've always thought that people, if we've got a happy and healthy population, then you know, that's where you get people that really want to work, they want to give back to their communities. So I mean, it's a big brief to cover. It covers public health and all sorts of community safety, fire. It really crosses over into so many areas. So for example, if you're looking at violence against women, you might want to do lots of involvement in schools to get discussions about healthy relationships and unhealthy relationships and stop the cycles of abuse and things like that. So that would be working with the children's portfolio holder, and also obviously health. Public health is all about prevention, and that's what I'm really interested in. One thing that I do want to focus on is mental health, both with children and adults, and look at that. But all the things that sort of set people back, and I think with my portfolio, it can be the bits where people can fall through the cracks, and that's what I want to really make sure we do our best to make sure there's a safety net there. Cornwall, obviously, traditionally it's an area with low incomes, and we've got our housing issues and things like that. So, and they tend to affect that they won't, if you've got no money, then it will affect your mental health, and also your physical health as well. I think things can fall apart a bit. So yeah, it would be really looking at how we can support holistically, and I think this is what the brief would be about, is trying to support people. So I always think about growth, for example. If we can look at that in less of a sort of economic sense sometimes, but look at the growth of society and how people can contribute, I think that's really important, and that's where I see my role. I'm very much a people person, and I think I just focus on getting the most from everybody, and I think if we can get everybody contributing to society, that's where we really want to get to. But again in my brief, there will be people that are really struggling, either with the mental health or with addiction issues, or they're homeless, and so it really is about bringing everybody up and trying to make sure we're there to support everybody.